Welcome everyone. My name is Bethany Shiner. I'm going to be chairing today's panel. This is the third and final panel in this year's wonderful conference. Thank you to all of the organisers at the Informational and Policy Centre for a fabulous conference this year. The discussion on this panel is countering disinformation and rebuilding trust. And we have three presentations that are all equally incredibly timely and very, very important. So I'm really looking forward to hearing what they say. So quickly, the format will be that each presentation will last between 15 and 20 minutes. That will leave us with at least 20 minutes for questions and answers, because after each presentation, we will have 8 to 10 minutes of reflections from our discussant today. Once the presentations are finished, we will just move on to the next one and save all questions for the end. So please do not hesitate to submit your questions in the chat box, and I will read them out at the end. After the presentation, there will then be a coffee break. So the first presentation today is from Dr. Adina Harbinger and Dr. Mark Leiser. So Dr. Adina Harbinger is Senior Lecturer in Media and Privacy Law at Aston University, and Dr. Mark Leiser is Assistant Professor in Law and Digital Technologies at Leiden University. And the title of this presentation is The Online Safety Bill Saga. So without further ado, I will leave it to you. I will give you up until when we get towards 20 minutes. If you're still going, I'll just give you a gentle nudge, but please take it away. Thank you.
That's great. Thanks very much, Beth, for introducing us. And I would like to thank Nora and the team for organizing the conference and for the invite. I would just like to say that we have actually changed the title. Well, since we've submitted and got accepted and the program was published. So the title is actually now, as you can see it on the cover slide, it's redacted, the article categorized harmful by the government. I will just briefly in a few words say a few words of the background and then pass on to Mark for the introduction. So this paper builds on our previous paper called Content Not Available, published in the Technology and Regulation Journal, and it also follows on some of my work with the Digital Communications and Digital House of Laws Committee on Communications and Digital, and the oral and written evidence that I worked on for the Joint Committee Online Safety Bill, and of course Mark's work on regulation and technology more broadly. So in this paper, building on the previous paper, we take two directions. The first one is reviewing and criticizing what the bill brings actually in some of its clauses, and then more broadly we discuss risk and precautionary principle as applied to the regulation of platforms and online safety, plus the overarching compliance with the human rights regime of this proposal. Of course, I'll pass on to Mark and come back to you later.
Thanks, Adina. One of the challenges I think of thinking broadly about the regulation of disinformation, basically since Donald Trump hijacked the term fake news, is the kind of incredulity that kind of pops up when you hear about our proposal for regulating platforms in response to the proliferation of deceptive content. On the other hand, you have the EU's kind of almost feels like at times that they're passing legislation every day. You know, the Digital Services Act, the Digital Markets Act, the Data Act, the Data Government Act, the AI Act. It seems to be never ending. And every single one of those pieces of legislation have some part of it dedicated to or application to the regulation of deceptive content, or the proliferation of deceptive content. And but we also have these kind of very gaping holes. We have nothing really that's regulating the content of political issue advertising, for example, at the moment. And we've left that to member states and the United Kingdom still doesn't really regulate the content of political advertising. We have the GDPR, which has this massive enforcement problem. We have a number of column spaces dedicated to the ethics of big tech and the application of ethical codes to try and build upon law. And some member states, and Latvia in particular, has even criminalized the act of disseminating disinformation. So when you bring it all together, you kind of see that there's about 3 different emerging models of regulation for platforms across Europe. You have the kind of administrative response to platform regulation that's been taking place in Germany. You have another model which is based upon passing new laws or amending existing specifics. So France, for example, education law, the law of politics. And then you have this really new form, I think, of emerging platform regulation that's that's coming out of the white paper that Adina and I wrote about, which is imposing a duty of care on the platforms. And when we started thinking about this, I mean, the background of this was Adina and I were going to write a satirical paper with a bunch of stuff that you couldn't publish and hope that it got. And ironically, we got the paper accepted, and then the editor of the paper rejected it on the basis of, well, we've got a little bit of backlash about this, so we're not going to publish your paper even though we've accepted it, which was kind of the ultimate irony. And then as we've been working and looking at this online safety bill, and when you marry the kind of climate in which we live at present, the political climate, things like cancel culture, the reduction or the removal of a no general monitoring obligation, and the way that the online safety bill has been proposed, and some of the sort of circumstances, politically speaking, around the bill, I think it's incredibly problematic. And it is going to be, in practice, a disruptive event to fundamental rights. So what I'll do now, we'll split this presentation sort of 2 or 3 different parts. I'm going to talk about the appropriateness of risk regulation after Adina kind of gives you a bit more of an in-depth look at the online safety bill itself. And then some issues have popped up while I've been thinking about risk regulation and the precautionary principle, about whether or not the online safety bill would even amount to a convention-compliant act. And then we'll close with some final things to think about regarding speech. So I'll hand it back over to Adina.
Thank you, Mark. So, how much in depth this can be, it's questionable, but we have a full paper coming out. So I will focus my part of the talk with an overview of the online safety bill that quite a few of you are very much aware of, and there has been a lot of discussion on Twitter and elsewhere about these provisions. So I will focus just on a few issues that we thought were interesting and important when it comes to this approach to regulation. And the first one is, I should have said, I'm not going to talk about the duty of care and the overarching duty of care that we examined in the previous paper, and the change that the bill has brought in terms of splitting this one overarching duty of care into specific duties of care. And there has been quite a lot of discussion whether in the committee and during the inquiry whether this should be brought back to the overarching duty of care. And it seems that it won't, because the Secretary of State in the end said that the lawyers in the Parliament said that it couldn't work in her testimony. In summary, so what I'm going to talk about is represented in this slide is this odd distinction between journalistic and the content of democratic importance in the bill. So these are clauses 13 and 14, and we think that these are very, very problematic distinctions, and they often overlap. They're vaguely defined, and they are overall they aim to distinguish something that is not easily distinguishable, and there has been a subject of discussion in courts for a long time now, and a subject of the free speech decisions, and of course theory around the freedom of expression and media freedom. So in clause 13, the bill introduces this concept of a content of democratic importance, as content intended to contribute to democratic political debate in the UK or a part of it. So arguably quite broad, but then a fear is whether this phrase of political debate only really limits protected speech here to what is a very narrowly political discourse and political party discourse, and to what extent this can be ever distinguished from journalistic content that is set out in clause 14 of the bill. So, for example, is speech related to health and vaccines political and as a consequence of democratic importance and protected by clause 13 or not? Is speech related to religion or questioning religious views of democratic importance and political matter? So is blasphemy protected? And Graham, our discussant here, has written about this example as well, and it's a really interesting one. So can we argue that this should be protected as a content of democratic importance, or as the House of Lords Committee says, for example, any topic of a social change, would that be included in this concept or not? So it is really problematic. And if we move on to clause 14 of the bill that talks about the journalistic content, that is the content generated for the purpose of journalism, including citizen journalists, as long as there is a link, a UK link of the content and the author. So the bill goes on to explain that the link is if there is the link if the users of the service form one of the target markets of the content, and the content is or is likely to be of interest to a significant number of UK users. There is also formulation that a person needs to be, and the contact needs to be in the UK, somewhere in this clause. So there is some confusion as to whether, to give you an example, a journalist based in the Republic of Ireland writing about a situation in Northern Ireland would fall into arguably a topic of the interest for the UK with the UK link, whether that content would be protected according to this clause. So one of the big issues that this distinction brings actually is the redress mechanism. So with democratic, the protection of democratic content, category 1 service providers are not obliged to provide a redress mechanism for users, for individuals, whereas for journalistic content, this mechanism is available. So the problem here, of course, arises who will have this right to redress and to what sort of content, if we consider this content quite confused and vaguely defined. So these are just a few remarks. Of course, I don't have time to go in detail here, but I will move on to the second problematic concept proposal in the bill, which is this weird construction or a concept of legal but harmful content that many free speech advocates, academics, and other authors have criticized. So the question, the definition of this content is that firstly, of course, that the provider has reasonable grounds to believe that the nature of the content is such that there is a material risk of content having or indirectly having a significant adverse physical or psychological impact on a child or an adult, clause 46. So the problems here are firstly indirect harm and the problem with causation of this harm that Mark will talk about a little bit more in his talk. So is offensive speech of any kind indirectly harming psychologically individuals? Could this be a content that service provider would have to deal with according to the clause, prescribe the ways to deal with or not to deal with this content in their terms of service or not? So the argument is, of course, that if the Parliament indeed thinks that content is harmful and crosses this threshold, then the legislation needs to clearly outlaw this content and not introduce something that will be left for the regulators to handle and define, and of course for the Secretary of State as well in their powers to designate which of this content is priority harmful content and should be dealt with a priority. And then of course another problem with this concept is this psychological impact of an adult of ordinary sensibilities that again unfortunately I can't go in depth to explain, but the problem is the ordinary sensibilities as a test that hasn't been developed by the courts, and that is problematic in terms of interpretations and the subject and the object, of course, of this speech. So that the questions arise as to how Ofcom can interpret this and how the companies and the regulated services can again understand who an adult of ordinary sensibility is, and of course also the adult that possesses characteristics of certain groups and who can be indirectly psychologically harmed by content, and the thresholds seem to be impermissibly low for this. So examples again could include blasphemous content, violent content of any kind, satirical content, anything that could potentially be harmful to mental health of a user. And then moving on to the final point very, very quickly that we discuss again in more detail in our full paper is the problem with the regulator and the relationship with, in particular, Ofcom as the designated regulator and the Secretary of State. So the Secretary of State in the bill has been given really, really broad powers. For example, to designate priority content that I mentioned, to decide what the exempt services are, and to also decide on strategic priorities of Ofcom. With Ofcom, the problems that have been identified are, of course, capacity that is building as we speak, as we understand. We will see to what extent, and then independence, thinking about their relationship with the Secretary of State and the powers of the Secretary of State here, but also regulatory capture and with regards to the staffing of Ofcom, employees moving from the companies to Ofcom that we have very recently seen in the DRCF, but more generally and overall, the readiness that the Secretary of State has shown in their statement to really influence this area and work with Ofcom to regulate speech basically and decide what they think are priority and harms. So we see that of course regulatory independence here has been really compromised from the outset, and we hope that some of this will change in the final version of the bill, but definitely a lot of the problematic areas seem to be staying. So I will pass on to Mark, and apologies for a very quick run. We're running out of time, so Mark will talk you through the a broader issue of regulation precautionary principle now.
Mark, you're on mute.
Accidentally clicked the button there. Yeah, so one of the things that happened, again, give you a little bit of background, was Adina and I were talking about the duty of care to protect society from sort of harmful disinformation. And there's obviously this kind of weird test that has been put into this of like reasonably believe. And I always think of it a little bit differently. It's like, well, okay, well, what would be reasonable to believe? Well, we have certain things that have popped up, 10 years ago, no, sorry, not 10 years ago, sort of 5 years ago, the Comet ping pong story about Democrats running a child sex trafficking ring out of a pizza shop in Washington, D.C. And then all of a sudden it gets posted all over QAnon and 8chan websites. And then a guy takes a gun and goes in and starts shooting up the place. I mean, is it plausible to believe that that is a plausible conspiracy theory? So we started thinking about this. It's like, well, if you're trying to sort of protect people from harm, and you're trying to protect people from the likely outcomes, shouldn't you also be protecting people from unexpected outcomes? And that lowers the bar quite substantially, I think. So this is something that we came across and talked about and sort of stimulated our discussions about thinking about these roles. So, this is a conspiracy theory that's going around right now, which is completely ridiculous. Pigeons are liars, that they're all government surveillance drones. And the birds aren't real. They charge themselves on power lines in order to do surveillance on all of us. We talked about flat earthers. We all have heard of flat earthers. But if that's not plausible, then there's other things that wouldn't be plausible to anticipate either. And we know that that's not to be true, because within the last year or so, we've had real-world events that have manifested themselves as a result of seeding themselves as a conspiracy theory online. So you get people that genuinely believe that 5G towers are responsible for the spreading of coronavirus, and then that manifests itself in a real-world event where 80 of them are now have been attacked and subject to arson. So is it reasonable to anticipate the unexpected? And if the answer to that is yes, then all early seeding of conspiracy theories would have to be removed from the internet under the duty of care. And if it's not reasonable to anticipate the unexpected, then all of the zany conspiracy theories would thrive online, because no platform would satisfy the test of reasonably be to expected these types of content. So that promoted other ways of us thinking about risk and the precautionary principle. And it doesn't come as any surprise that risk is at the heart of techno-regulation. In fact, GDPR operates purely on risk-based regulation. And the failure to comply increases the risk of harm to data subjects in particular. So when you consider Article 35 of the GDPR, you get where a type of processing is likely to result in a high risk to the rights and freedoms of natural persons, the controller shall, before the processing, assess the impact on the protection of personal data. So risk in that sense requires both an event, which is the lack of compliance with the regulation, and its consequences, the risk to the data subject as a consequence. But the Online Safety Bill takes a completely different approach. It doesn't require a specific event. And the threshold to determine the effects becomes purely hypothetical. And it's a very confusing test. As Adina had mentioned, for example, Section 46, content is within this subsection if the provider of the service has reasonable grounds to believe. So you have a subjective objective test that the nature of the content is that there is a material risk of content having or indirectly having a significant adverse physical or psychological impact. So just to flip it around and sort of look at the GDPR as a comparison, imagine if lawmakers built data protection regulation around the notion that a data controller had the right to a subjective belief of whether their processing caused harm, yet we're giving that power to platforms to make the determination. And unsurprisingly, in our paper, we argue that the risk calculation should only come after the platforms have fulfilled obligations with fundamental rights, like Article 10 of the Convention, Article 11 of the Charter, Article 19 of the ICCPR, particularly the right to receive information. And without going into too much detail here, we point out that risk regulation not only requires risk analysis, but effective risk management. And risk regulation requires risk management through things like reduction, control, response, and mitigation. And the latter.
Mark, you're just out of time. So could you begin wrapping up?
Sure. Yeah, of course.
Thank you.
So one of the things that we've been doing is thinking about all the different problems that we have with speech and trying to wrap that around risk regulation. So when you don't have any agreement on cultural social norms, when you don't have any agreements on science, when you don't have any agreement on who will make reference to the impact that it's causing on people, then, and if you do end up removing a general monitoring obligation as a result on top of that, the only thing that can happen is proactive measures to constrain people's speech in a way that will cause the very problems that you're trying to prevent. So, I'll just tell you a very quick story. My colleague at eLaw has been doing research with drag queens, his term, not mine, and they use offensive content because they are reclaiming those words from people that have been using them in a toxic way to cause them offense. And they are disproportionately affected by content moderation. I can put a link in the chat later to this research. But that goes to show you that words evolve. And the Online Safety Bill is taking a very different approach to regulating content in a way that would cause us great difficulties and probably, I haven't gone fully into this, but whether it would amount to compliance with the convention. And one final problem is if you don't think that this is just the ravings of a madman or free speech purist, then look at what happened last summer with Priti Patel demanding that social networks take videos of migrants off of TikTok. And look at some of the special interest groups that are promoting the duty of care, that are complaining that the duty of care doesn't go deep enough, that they want it removed as soon as they become aware of the risk of harm. Not that there's harm, but that there's the risk of harm, which is a fundamental challenge for the implementation of a framework that also takes into consideration free expression rights. So in that line, I think we've got a very problematic bill that we're looking at. I don't think that I think it does reflect the United Kingdom's uncomfortable relationship with free expression, and that we could have taken a far more positive approach to content rather than the one we are now, where we're taking stuff down as opposed to giving people better information about the content that they're seeing. And I also think that there's real problems and challenges with this for human rights principles like foreseeability, the quality of law, fairness, transparency, and of course, non-discrimination. And on that note, we'll come to an end. Thank you.
Thank you, Adina. Thank you, Mark, for absolutely fantastic presentation. I mean, I, for one, did not know that pigeons are liars. So that's...
I don't think anybody else does either. But,
So again, anyone listening, please submit any questions you have into the Q&A as we go along. I'm sure Graham Smith, our discussant, will have lots to say at the end of all of these presentations. Moving on to the second presentation for now, we are very pleased to welcome Dr. Kim Barker, Senior Lecturer in Law at Open University Law School. She will be presenting on pandemic information responsibilities, balancing competing interests in pandemic information. Thank you, Kim.
Thanks to everybody as well at the Institute for their organisation in this and for the invite and extending the invitation to present this. I will start, as I tend to these days, with a couple of caveats, not about technology, not about Zoom, but firstly about the title. The title has stayed the same since I submitted the abstract. What has changed slightly is the content of it, largely because the data has taken the paper in a slightly different direction. But I think it will speak actually quite nicely to what Mark and Dina have said, albeit with a very different take. This will deal with some of the problems that they're trying to solve rather than trying to solve some of the problems that they've highlighted, if that makes sense. So some of this is new and hasn't been presented before. Some of it is data, which is quite interesting, albeit surprising, I think, for the research team behind the paper. So I'm going to talk about how we might balance competing interests in pandemic information. What I'm not going to talk so much about is how we do that in an online context, because a lot of what I'm going to share with you is information that we've gathered through research projects in 3 different territories, looking at the themes, the information, and the focus of reporting about the pandemic itself. And what that tells us, perhaps, about whether or not there should be a more broad brush duty about providing information of public interest with certain levels of responsibility, truth, and accuracy. I don't propose a framework for how we measure truth and accuracy, but that is something that I think we can pick up in some of the discussions later on. So what is this paper really about? Well, if we think about COVID-19, we've all learned a huge amount about COVID, period. We've all learned a huge amount about what we do and don't know about COVID and who says what about COVID and whether we think that is accurate or not, whether we take it from Boris Johnson's briefings at their peak once a day, or whether we take it from Donald Trump and his suggestion that if we all drank some bleach, that would solve the COVID problem. But what we do have now, perhaps more than ever, is information overload. But the problem with that information overload is it is an overload. We don't know exactly who to trust on information. We don't know who's reporting what their vested interests in that might be, especially offline rather than online. Questions at the start of the pandemic certainly arose about where the emphasis should lie on information. If we aren't going out, we aren't socializing, we aren't doing the things we're normally doing, where do we get that trusted information from? Can we get access to it easily? Are there checks and balances on that information? Are those checks and balances in place for corporate entities, news reporting to commercial business? So where are the checks and balances across all of those things? And should there, and this is the kind of question we're at now, should there have been specific responsibilities for ensuring that information in the public interest is reported, is accessible, and is available to everybody with an equal ability to access that information? So to put it in a slightly contextual way, in the first week of lockdown in the UK, 99% of the population accessed COVID-19 news at least once a day in some form. But when people dug into what that information accessing was in a bit more depth, 36% of those people looked at a BBC source. That, I think, in itself presents some problems, given some of the BBC issues. Only 16% of those involved in the survey actually looked at official sources like the World Health Organization or the NHS for their information. So that presents some challenges in terms of not just the amount of information that we're getting, but the reliability of it, the originality of it, and the reliability of it, if you like. So within all of the information overload, what we've tended to notice as we've looked through some of the data we've got is that there is huge potential for what we refer to as data delusion in media production and media consumption. More is definitely not better. More is almost certainly not more reliable, and more is almost certainly not that consistent. And the lack of official sources, if I can put it in that sense, that are easily accessible and easily digestible have presented some additional challenges when it comes to things like curtailing the role of influencers, curtailing the role of commercial influencers, getting science and facts wrong and right, and what is really the sensationalization of news in an environment where we're all hungry for information, but we're not necessarily hungry for fully accurate information. So what we also noticed when we started thinking about how we might go about exploring some of these issues is that an awful lot of the narrative now is very much about putting digital rights against public health. If you don't have the app and you're bothered about privacy, you're not so interested in protecting public health and protecting others. The track and trace program, we thought, would be one of the cornerstones of some of the interesting findings in terms of the headlines, news reporting, and the spreading of information. And actually what we found is very little was said about the track and trace program that was positive. It was almost exclusively negative, pitting everything against what was a almost flawed program to begin with. But nevertheless, the reporting around it didn't necessarily help the public health messaging that went hand in hand with it. And ultimately, all of the reporting that we've seen focuses arguably on public health, but then is broken down into different sub-themes and subcategories. But it keeps coming back to this notion as an undercurrent of digital rights. We have the right to access information. Almost everybody has some ability to access information online, even if that's from what would traditionally have been a broadsheet newspaper or traditionally would have been an offline broadcaster. So the ways in which we engage with information have changed, obviously, by virtue of the way the world has changed in the last kind of 2 years. But that doesn't necessarily mean that people's experiences of engaging with information is the same. So in order to figure out what the themes were that were being reported and what those reporting themes might mean for people's access to information, we've looked at a spectrum of mainstream news outlets from the UK, Germany, and Latin America. That includes newspapers, it includes some social media hashtags, and it includes some broadcast TV channels. We've taken them from a spectrum of political opinions, right-wing, left-wing, traditionally more centre ground, although with the obvious caveat perhaps that in Latin America, finding something in the centre ground was quite difficult in terms of what this information was. So what we tried to do was explore the themes. Were reports on emergency powers, on track and trace, on public health? Were they looking specifically at cleaning yourself, being very aware of others, the wearing of face masks? Were there specific focuses in the news reporting of just the death rate and the infection rate? Or was it broader than that? Was there a more broad brush approach to certain things which all forms of media focused on in their different respective reporting? And so if we take the UK, which is perhaps the most comfortable for all of us, what we saw in some of the information that we managed to gather and the themes that came out of it is that the UK took a very celebrity-focused approach to dealing with the pandemic in the reporting. So what we see is that the NHS almost became celebrity status in its own right. Yes, rightly, there was the need to protect it, and that was very much the main message at one point, not throughout. But as daily briefings continued and the political messaging continued about we need to do X, Y, and Z, it was all about protecting the NHS. It was less about protecting individuals in the population, and it was almost all exclusively focused on protecting the NHS, saving lives. And that came through in the newspaper reports, online and offline, that we looked at. It also came through in the social media hashtags that we explored. But what is perhaps more interesting that is that we've seen a change in habits from the Prime Minister and the government to some extent, even in the devolved administrations, to what we are referring to as an Americanization of information updates. Is perhaps the obvious example is the briefing room in Downing Street, very much similar to the White House briefing room. It's an Americanization of what we do in terms of how the government presents information to its population. Good or bad is a different issue and a different question, but there is this ability to present information and provide it in a very different way. There was also, interestingly, a theme even across some of the more right-wing newspapers that we're not allowed to criticise the NHS in any way. We have to protect the NHS, and that means we have to protect the reputation of the NHS throughout the trajectory of the pandemic. But also that then kind of morphed as individuals became more prominent. Captain Sir Tom Moore, for example, others, he's not alone in that. And they took on a different level of celebrity status because of their work to protect the NHS. And so there's a very positive narrative around all of those people involved and the NHS itself as an individual. But then what also came through in some of the reporting is that actually we need to be cleaner as people and society. So it was very much celebrity status, protect, then be clean, then trace. And the tracing is almost kind of the negative connotation to the two parts that have gone before it in the context of what reporters have focused on. And then one other interesting aspect that we didn't see in the other territories that we looked at and the headlines that we explored is the way in which reporters in UK media outlets are held to what is perceived to be a higher standard. Some individuals who class themselves as journalists erred and didn't stick to the rules and were rightly punished for that or benched from their TV shows, taken out of the front line for not sticking to the very clear mantra of what should and shouldn't be done. And that's very definitely something that we don't see elsewhere. So it's not necessarily that we've seen there's a responsibility in reporting and providing information to the public, but what we have seen in the UK media is responsibility in terms of leading by example from those who are reporting on those who should be leading by example. And that in itself suggests that there is self-awareness from those in the media industry that they should be doing better when it comes to information and reporting on it. In Germany and in the German media outlets, there's a slightly different take on what has been reported on. There's very much a distinction in terms of the personification. In the UK, we focused on people and individual stories. In Germany, that is very definitely a different stance taken in the media and the outlets. There is no personal aspect as such in some of the media reports we've seen, and shared responsibility is the emphasis that's been adopted. It's all about protecting everybody, protecting society, protecting the country, protecting healthcare. Sharing the responsibility at different levels of government is also a very dominant message. And it is perhaps, although there's no real evidence yet to support this, that their democratic infrastructure means that there's no single dominant government or leader who dominates that narrative. But there is also, and this is, I think, a particularly interesting point, factual orientation in the news reporting about the situation in Germany and how it unfolded. It didn't focus in the same way as UK media did on cleaning or the health service. It was very much, this is a factual situation with statistics. This was where we are at in terms of what the pandemic is and isn't meaning for us as a country and as citizens. And then what is very, very different to both Germany and the UK is the situation in Latin America. And this is perhaps because it's a very different set of cultural values and a very different environment in which the pandemic has unfolded and taken on a different light. But what's come through in the media that we've looked at in Latin America, particularly in Brazil and particularly in Colombia, is that there's been an emphasis again on the individuals, but not on the celebrity aspect of individuals. What has been the highlight there is the infighting, if you like, amongst the politicians about who is to blame. And that comes through very strongly in the Brazilian media. There's almost a personality obsession in the Brazilian media as to what is and isn't done. And there's less of an emphasis on how to handle the pandemic, how people are tackling different aspects of the pandemic. And also what is particularly prevalent is the role of fake news in Latin America and the spreading of it. So we have a very different approach in that we would distinguish between reporters employed by media outlets in the UK and those who are influencers spreading fake news on YouTube channels and social media platforms. In Latin America, what we see is that those who are presenting and reporting on the media in the mainstream media outlets are also the front face of the spread of fake news in social media situations. And I think that's particularly interesting in terms of what it means for people and the reporting. But that doesn't tell us a huge amount about the competing interests and pandemic information more broadly. And all we've got at the minute are some general themes. We don't have clear enough data from the study that we've done so far to suggest that there is a need specifically to talk about a public information duty or greater responsibilities on individual news outlets, or that there are certain tendencies in Western media or UK media or German media. And I think that is perhaps surprising. I wouldn't say it's a finding in and of itself, but it's something that certainly we need to do a bit more thinking about, because what we anticipated seeing were some very clear themes and some very clear ideas about what responsible sharing of information would be in times of public crisis. And that hasn't come through from some of the things that we've looked at. What we do see are different styles in information and the sharing of information and the reporting of it, but that is perhaps to be expected. We also see, and this wasn't so expected, the personification versus infighting versus the celebrity status. And celebrities were used in the UK to spread the idea that the vaccine is a good thing and everybody should have the vaccine, but also to spread the idea that we should wash our hands frequently and in a certain specific way. And that's a very different take on celebrity status and the reliability of information that we see in other jurisdictions and in other forms of media information. But none of these things address the immediacy of information problem. And we don't just want information immediately. We want the most recent information as soon as we can get it from as many sources as we can get it from. And it seems to be that there is an assumption that if you get it from several sources, it makes it reliable, rather than investigating the reliability of the information from a single source in and of itself. So more reporting the same seems to have been taken as meaning that that information is right rather than wrong, or accurate rather than inaccurate. And that presents some challenges, I think, both in the reporting, but also in the consumption of the information that we're engaging with. And the other thing which was quite intriguing really early on was the shift to paywalls, whereas sources previously had been more freely open to people with free trials and with certain limited availability for a certain number of articles in a week, for example. That shift was almost immediate at the start of the pandemic. And so that has reduced the number of sources which are not behind a paywall for those people who either can't or won't pay. And that presents, again, a greater level of challenge in terms of where they go for their information, which is reliable or not. Tracing apps didn't feature in the reporting particularly until they went wrong. And it's only when they went wrong that they started to take on this kind of prominence of their own. And what also didn't feature so much was a lot of the work done by NGOs and academics and legal teams in the background to ensure that our rights, digital rights, were protected. So that was also very not a feature in the reporting, which, frankly, given the way in which we need to balance our interests and the problems around emergency lawmaking, is somewhat surprising, but also disappointing, I think, for information and protectionism. What we do also see are generational divides, and those generational divides cross-cut with reporter responsibility and the standards of information that is given, but also reported on, and the ways in which we report on that. So across the board, there is a suggestion, although that's all it is at the minute, that there is a lack of responsibility on reporters, that there's a lack of responsibility on media outlets, and that there is generally all round a lack of the balancing of interests in the sharing and reporting of information. Perhaps not surprising, but I suppose in some respects nice to have that clarified, that there is that inbuilt self-interest in commercial entities versus official outlets, where there is perhaps more accurate information, albeit not as easily digestible and available to the public. So what does it mean going forward? Well, going forward is a good question. We would all, I think, hope that we're not going to be in a situation where we have another pandemic that we have to navigate. Although in some respects, if we do, I like to think we'll be a little more prepared than we were for this one. That doesn't necessarily help us when it comes to information, official information, and accurate information. COVID-19 has caused a huge number of changes, not necessarily for the better, but it's also given us a really unique, in some respects, a super spreader phenomenon to think about. It's a super spreader in terms of the medical aspect of it, but it's also an information super spreader. And that has proved to be both challenging, but also potentially engaging for the people who want to explore it and explore what it means for the way in which we engage with news and information. And ultimately, what it has told us is that we do need to respond to things quickly, but in responding to things quickly, we need to have a viable framework and a viable set of norms and values and understandings of what we should be looking for when we're engaging with different sources of information. Admittedly, at a local level, but also national and regional levels, there are differences in how that happens. I think there are some lessons to learn going forward about public information, about where we can get that from and what that might mean for people. But also, I think some of that takes us back to the debate about what is easily accessible information for people who are not necessarily legal experts, who are not medical experts, and who are not that well informed. I think we all are familiar with the trope of Chris Whitty and his slides, and his next slide, please. Lots of those slides weren't necessarily that easy to digest. So there are some questions around how that is reported and how that's covered and how that's digestible for people who perhaps aren't that familiar with the ways of reading information that some of us might be. And one other final thing, and I'll finish on this. We are not aligned to focus on legal protections of information. Mark and Adina have outlined some of the risks and the ways in which reality is different from the proposed regulations. And some of that comes through very clearly in some of the reporting. Not that interested in how accurate information is and how reporters are checking that that information is accurate, but also not that interested in legally protecting certain information and make it fully viable and available to everybody else. And I think in the age of information, that is a huge challenge for both online content and offline content. And I will leave it there. Thank you very much.
Thank you ever so much, Kim, for a very clear presentation of some very interesting and important research. That's fantastic. Now we come to our third and final presentation from Dr. Claire Basson, who is Associate Professor in Law at Northumbria University. One final reminder that if you do have any questions, any thoughts, comments, please just put them in the Q&A. Claire's presentation is going to be on young people's views about the government's use of their data in response to COVID-19. Claire, take it away. Thank you.
Okay, so my background is that I'm an associate professor in law at Northumbria University, not in technology, which is why I haven't managed to work out how to use the mute button yet. My particular research interests lie in privacy, and particularly the privacy of children. As you all know, the COVID pandemic has had a significant impact on children, and there's an increasing amount of research which is looking at the impact of the pandemic on children's well-being and reporting children's experiences themselves. Very little, though, has been written about the impact that the pandemic has had upon children's privacy. In 2021, the Observatory for the Monitoring of Data-Driven Approaches to COVID, known as Ondac for short, conducted a study which sought to address this, and it explored what young people thought about the government's data-driven approach to tackling the pandemic. And in this paper, I'm going to discuss this research, outlining the children's views and the wider implications of this research. So Ondac is a collaboration between Northumbria University and the Royal United Services Institute and was funded by the AHRC. The original funding proposal envisaged that there would be 3 discrete work packages. The first would involve a stakeholder mapping and landscape assessment exercise, and that would be to determine what stakeholders understood by the term data-driven approaches and what they considered were the most important approaches in terms of benefits and risks. And at the bottom of the slide, you'll see a summary of what we understood stakeholders to mean by data-driven approaches. In the second work package, which built on the first, we again used stakeholder interviews together with a literature review to analyse some of the legal, practical and ethical issues arising from key data-driven approaches that were identified in the first work package. And then the third work package was a nationally representative survey in which we explored the public's views about use of medical, mobility and wastewater data. And my colleague Rachel also talked about some of those work packages yesterday. In the initial stages of the Ondac project, during our stakeholder mapping and landscape assessment exercise, we approached a wide range of professional stakeholders and organisations to determine what data-driven approaches were being taken in response to the pandemic. And we were keen to ensure that in that work package, we captured issues affecting all sectors of society. So we approached national organisations who we thought might be able to provide insight into the child's perspective. Unfortunately, none of the bodies that we approached responded. And for that reason, we therefore decided to add a 4th work package, specifically to explore the perspectives of children and young people. You may wonder why we thought it necessary to focus explicitly on children, and there are 2 reasons for this. Firstly, there have been concerns increasingly expressed about the datafication of society and children in particular. During the pandemic as well, increasingly children have had to move online with their data increasingly available to big social media companies, but also to edtech companies. And vast amounts of children's data is, of course, also held by local and central government relating to their health, their education, every aspect of their lives. This wasn't, though, the only reason for deciding to speak to children. Article 12 of the United Nations Convention for the Rights of the Child says that states should assure to the child who's capable of forming his or her views the right to express those views freely and should give due weight to those views according to the age and the maturity of the child. However, a report published by Barnardo's early in 2021 made a key comment that really resonated with me. And it said that throughout the pandemic, children and young people have told us that they didn't feel heard, yet the decisions being made affect their futures most of all. The key aim of Ondac's research with children was to find out whether young people knew how their data had been used in response to the pandemic and what they thought about it being used in that way. The data collection was conducted by an organisation called Investing in Children, and there were several reasons for us deciding to work with this organisation. Ondac was a rapid response project. It ran from November last year until November this year, and so it was over a relatively short timescale. None of the team, which included lawyers, statisticians, researchers in human-computer interaction, would class themselves as experts at engaging in research with children. We were conscious of the difficulties in recruiting young people for research at the best of times. And at the time when we decided to undertake the research with children, it was January, late January, early February, and we were back in the middle of a 3rd national lockdown. We did consider the possibility of recruiting young people via schools, but with school bubbles, restricted school access, and obviously the lockdown, we realised this wasn't going to be possible, and that also similar issues would be raised if we tried to access children via youth organisations. So we decided that we would work with Investing in Children, who are a children's rights organisation based in County Durham. Investing in Children was set up in 1995 as a partnership between Durham County Council and the Strategic Health Authority, because both of these bodies wanted to ensure that their policies were informed by a young person's perspective. But Investing in Children has actually since become a standalone organisation and works now with bodies across the UK and also in Europe. Investing in Children's primary but not its only means of engaging with children is through an agenda day approach, and this is used to encourage young people to express their views on issues which affect them. Essentially, young people, who are known as facilitators, are supported by a project worker at Investing in Children who talks them through the topic that the young people are being asked to discuss. And then these facilitators then lead the questioning, take notes, and write a report of the agenda day. And the day itself is a totally adult-free zone. During the height of the pandemic and even into the summer, these agenda days obviously had to move online and took place via Zoom. And before the agenda day for this project took place, Investing in Children advised us that they knew that some of the young people were now starting to experience Zoom fatigue. So they suggested that we also offer the young people an opportunity to provide their views via an online survey. In total, 17 young people engaged with Investing in Children to provide their views either through the agenda day or the online survey. In the end, the agenda day was only attended by 2 facilitators and 3 other young people, all who were aged 15 to 18. And then the survey was completed by 12 young people aged between 11 and 18. The limitations of this research study do have to be recognised. Obviously, the number of participants was relatively small. It's also unclear how many young people were aware of this research, because recruitment to the agenda day and to the survey was via Investing in Children's mailing list and their Twitter account. And although I know they've got several thousand on their mailing list, that's obviously quite a small number in comparison to the population of children in the UK. So obviously this research isn't in any way representative. Another limitation came to me when I was analysing the data, and I discovered that although these survey responses were provided by individuals, the agenda day report generally provided comments from the group rather than individuals. On the advice of the young people, the agenda day also covered just 2 of the 3 scenarios, which I'll talk to you about in a minute. But survey respondents actually responded to all 3 scenarios. Finally, the agenda day obviously allowed for discussion and exploration of ideas, and that might explain why when they're responding to some of the questions, the young people attending the agenda day appear to all be in agreement, whereas the respondents to the online survey simply provided their own written answers to the questions. Despite these limitations, we believe that this research does nonetheless provide some important insights into children's views, and that it also indicates that future academic work in this area would also be merited. So I just want to tell you first a bit more about the brief that we gave to Investing in Children. So in June 2021, we sent through a detailed briefing note to Investing in Children to explain what we wanted to explore with the young people. And at that point, we also met with a project worker from Investing in Children, together with 2 young people, so that we could discuss that brief with them. In the brief, the young people were asked some broad questions to find out what they knew about the government's response to COVID, how they'd acquired that information, and whether they felt they'd been given enough information. They were also asked whether they thought their views had been considered enough, and also what solutions they would offer for addressing the pandemic. We also explored some of the issues that come out of the earlier work packages and which we thought children might have experience of. And we used scenarios to explore 3 specific issues. We firstly asked how the young people would feel about their wastewater being tested to find out if people in their locality or their street had COVID and how they'd feel about such information being shared with others. We asked them how self-isolation requirements had impacted upon them and how they'd feel if the police were given information that they or a member of their family was self-isolating, and how they'd feel about their family being monitored to check it was complying with self-isolation requirements. We asked how they'd feel if an algorithm was used to determine exam results, so proposed something very similar to the scrap plan to use algorithms from 2020. We found that the young people who participated in our research were aware of many of the measures introduced by the government to address COVID. And they mentioned social distancing, wearing of masks, vaccinations, the travel scheme, test and trace, the NHS COVID app, and self-isolation requirements. Some of them also had an awareness of the way that their data was being used to protect public health, mentioning monitoring of data relating to infection, to hospitalisation, and to mortality rates. Some of them also mentioned the wastewater analysis. The young people said that they used a variety of methods to obtain their information and referred to sources such as social media, schools, family and friends, and televised or printed news. They also referred to the government's own website, but they said that they thought that was rather difficult to read and understand and difficult to navigate. When the young people were asked about the testing of wastewater to identify COVID hotspots, they offered an interesting mix of responses. So all of those attending the agenda day apparently considered a good way of identifying COVID hotspots, as did 6 of the survey respondents. But 2 of the respondents to the survey weren't really sure, and 4 objected to the idea, with 1 explicitly commenting that they thought consent to use their information should be sought first. When they were asked who they thought the information should be shared with, the local authority, health professionals, the police, the Prime Minister, all or none of these groups, they again offered different views as regards who they thought the information should be shared with. Although most agreed to some information sharing generally, the agenda day participants commented specifically on the police not having any business in knowing this information, because the young people couldn't see what the police were doing protecting the public with it. The survey respondents were also less likely to agree to information sharing with the police than with either health professions or the local authority. All of them were also less likely to be willing to share information if that information wasn't anonymised. And these responses were very much in line with the responses to Ondac's Adult Public Perception Survey, which Rachel talked about yesterday, and which found that people were less likely to want to share information with the police than with the health sector or with the local authority. And they were less likely to want to share information if it wasn't anonymised. Young people, as I said, also asked how they feel about information being shared with the police to monitor compliance with self-isolation. The young people who were attending the agenda day didn't explicitly address this question, but amongst the survey respondents, there was a real split of views. 5 thought it was okay, 4 were unsure, and 3 disagreed with it. 2 of those who disagreed again expressed concern about the police having that information, because 1 thought that the police were corrupt and biased, and the other expressed concern that fines that might be imposed by the police would impact disproportionately on poorer families, where people might have no choice about going to work. It's interesting to see, though, how important it is not to just discuss issues in the abstract, because when asked how they'd feel if their family itself was monitored, 8 of the 12 respondents objected to the idea of monitoring. In the final scenario, the young people were asked about the use of an exams algorithm, and all of the young people responded to this scenario. All of those who attended the agenda day, who were aged 15 to 18, were aware of the government's proposal in this regard, because some of them had experienced a similar situation last year. Only 5 of the survey respondents were aware of the plan, though, which was surprising given that several of the people in this group were in the 17 to 18 age category. Again, we saw a great diversity of views. All of the agenda day respondents were against the idea, 6 of the survey respondents weren't sure, 4 were against it, and only 2 of the survey respondents thought it was a good idea. There are a number of key messages or themes that we found were coming through from the young people's responses. The first of these was that they didn't seem to have always been informed about the issues affecting them in a manner that they could access and could understand. Many of them had views about how their data should have been used or how it should be used, but they hadn't been asked for their views. All of those who were attending the agenda day said that they wanted to be asked before decisions were made that were impacted upon them. And 7 of the survey respondents also thought young people should have been asked before key decisions were made to close schools, to tell them to wear masks, or to tell them to get tested at school. The fact that young people haven't been asked about many of the issues impacting on them meant that their views hadn't been considered. And generally, as you'll see, the young people expressed a view that they hadn't been considered enough. The United Nations Convention on the Rights of the Child affords children a range of rights, many of which are relevant to this study. Some of the young people indicated that during the pandemic, the government hadn't always provided the information they needed or wanted, and in the form that they wanted. And this obviously has implications for their ability to comment on what's happening to or proposed for them, but also for their rights under Articles 13 and 17 of the United Nations Convention. The young people suggested the government's website could be improved to afford them with key information, and that the government could therefore do more to ensure that Articles 17 and 13 rights are respected. Young people expressed concerns that they haven't been able to provide their views. This again has implications under Article 12. Article 3 of the Convention states that young people's best interests should be the primary consideration of government and legislative bodies. But this research indicates that young people don't believe that the interests of children have been considered enough. Children also have a right to privacy under the Convention and under Article 8 of the European Convention. Some young people clearly had concerns about how their data was or might be used, and their inability to express a view about this and also more widely. In its September 2020 consultation document, Data: A New Direction, the Department for Digital Culture, Media and Sport states that it's going to build on the high watermark of data use set during the COVID pandemic to establish a new data protection regime. And it also suggests that there's huge potential for linkage and reuse of data sets across organisations, domains and sectors to deliver wider public benefits. The issue of children's datafication is therefore not going to go away. It's concerning, therefore, that this consultation only briefly mentions young people and children, and young people and children and organisations that engage with them are conspicuously absent from the list of organisation individuals which the government focuses upon in its consultation. Although this study is far from representative and focused on a relatively narrow or limited issue in data-driven decision-making during the pandemic, it confirms a much bigger issue that's been identified by other researchers during the pandemic, a lack of engagement with young people. But it also highlights specifically that young children and young people want to be asked about how their data is used. Although this research didn't set out to determine a strategy for engaging with, informing and consulting young people about the use of their data, it does suggest that one's needed. More needs to be done to make sure that young people are informed about issues that affect them so that they can provide an informed response. And a strategy is also needed for then seeking their views. The young people who spoke to Investing in Children suggested a variety of ways in which their views could be captured, through schools, through surveys, through social media and via youth organisations. But these aren't the only options. The Children's Commissioner for Wales, in conjunction with the Welsh Government, and also the Scottish Children's Parliament, as well as several other national organisations, have managed to speak to children about their well-being during the pandemic. The government could learn from what's been done to develop a strategy for ensuring children's views about the use of their data are heard. What this research also highlights, though, is that young people have very different views, that they're not a homogenous group, and they will also have different needs. So a variety of approaches are needed to take account of these different needs, of whether young people are attending school or not, of whether they can access digital technologies or not, and whether they have additional needs for support. And young people themselves are the best people to advise what the approaches are that are needed for engaging with them. Finally, I suggest that there's also a need for further academic research in this area. There's an increasing amount of attention being brought by bodies such as Five Rights to the importance of affording children the same rights in the digital sphere as in the ordinary world. And organisations such as Defend Digital Me have done important work on highlighting the problematic use of children's data in the educational context. But far less attention seems to have been paid to how the state is using children's data and how such data is being shared. Very little work appears to be done which specifically considers how children feel about the use of their data for the public good, how they feel about their data being used for profiling, how they feel about their data being shared across the different public sector bodies, but also between the public and the private sector. There's more information at the links that I've put here about the Children's Project itself and also about the Ondac project. And I'd obviously also very much welcome any questions that you might have about the research at the end.
Thank you very much, Claire, for a breakdown of this very important qualitative research looking at the failure for children's rights to be taken into account. So now we have a coffee break until 11:30, at which point there will be the plenary panel, reflections, insights. We've got a host of absolutely incredible speakers, so please return at 11:30. Thank you once again for the organisers, and thank you especially to our presenters and our discussant. Thank you.
Hello to everybody who is just joining us, and welcome back to everyone who was with us this morning or has been with us throughout the conference. We return from a really excellent and provocative, but not, I stress, in a harmful or unlawful way, academic panel this morning on countering disinformation and rebuilding public trust. And if you are just joining us, please note that this morning's panel will be made publicly available after the event, so you can watch it at a future date. And if you have any interest in the online draft safety bill, I highly recommend that you do so. Now, I am truly delighted, really thrilled to introduce you to our fantastic plenary panel this morning, who will be bringing us expert insights from the UK and the European Union, from across the public sector, the regulatory space, the UK Home Office, civil society, and academia. In terms of format for this plenary panel, each of our panelists will present their interventions. This will then be followed by a panel discussion and a Q&A with the audience. So to begin, I am delighted to introduce our first speaker, John Sheridan. John is Digital Director at the National Archives, with overall responsibility for the organisation's digital services and digital archiving capability. His role is to provide strategic direction, developing the people and capability needed for the National Archives to become a disruptive digital archive. John's academic background is in mathematics and information technology, with a degree in mathematics and computer science from the University of Southampton and a master's degree in information technology from the University of Liverpool. Prior to his current role, John was the head of legislation services at the National Archives, where he led the team responsible for creating legislation.gov.uk, as well as overseeing the operation of the official Gazette. And on behalf of all lawyers in the UK and elsewhere, John, I want to thank you very much for those fantastic projects that you undertook. John also recently led as principal investigator an Arts and Humanities Research Council funded project, Big Data for Law, which explored the application of data analytics to the statute book, which won the Halsbury Legal Award for Innovation. John has a strong interest in the web and data standards and is a former co-chair of the W3C e-Government Interest Group. He serves on the UK Government's Data Leaders Group and Open Standards Board, which sets data standards for use across government. John was also an early pioneer of open data and remains active in that community. John, you're very welcome whenever you're ready. Thank you.
So, good morning, everyone. So I'm going to talk a little bit about the experience that we've had at the National Archives as the provider of public access to legislation, and along the way, some reflections around the importance of institutions to the well-functioning of the state and the role that institutions can play in moments of crisis, as we've seen with the challenge of the pandemic, to objectives like supporting the rule of law, and in particular for us, with the responsibilities for publishing legislation, making sure that the public has access to the law in a context where the law is changing rapidly, and particularly with the pandemic, is having a big impact on our everyday lives. And we've seen an extraordinary period over the last 18, 19, 20 months. So there's been over 1,000 pieces of legislation in the UK relating to the coronavirus and the legislative response to the pandemic. And that legislation has been made at all times of day and all days of the week. For the first time, we've found ourselves registering and publishing statutory instruments on Saturdays and on Sundays, and we found ourselves registering and publishing statutory instruments into the early hours of the morning. Now, in approaching the pandemic, the National Archives set itself two strategic objectives very early on. It's like way back in March, as we went into the first lockdown. The first was around capturing the record, and the second was around trying to aid legal certainty. And we deployed two capabilities to that end. The first is through our work with archiving what government is saying and doing on the web and maintaining a record of what the government has published on the web through our web archive. And our web archive has grown by 30%. It's a 25-year-old collection, but it's grown by 30% since January 2020, primarily through the capturing of the record that we've done during the pandemic. And aiding legal certainty has been very much about what we've been providing for the public on legislation.gov.uk. Now, we register and publish statutory instruments, and if you've not been involved in that activity, it probably doesn't mean very much to you in terms of what that concretely means. It means when we receive a piece of legislation that has been made by the appropriate or responsible authority, we're essentially checking that that legislation has been properly formulated typographically. We are recording the powers that have been used and checking that those powers exist, essentially as a due diligence check, before then going on to number the statutory instrument and to publish it. During the pandemic, where we were seeing quite a high number of emergency regulations, we were able to do that whole process on average within 19 minutes for emergency coronavirus regulations. Now, a lot of the law during the pandemic was amending previous regulations. And like many people, I found myself for several months back in 2020 living by the wording of Regulation 6 of SI 2020-350, which I think was modified 6 or 7 times before being revoked. And we were able to maintain up-to-date versions of the texts of the key coronavirus regulations. Normally within 24 hours, we would have a version of the text with the amendments included and have that published on legislation.gov.uk, which made a real contribution to helping people who wanted to read the text of the law engage with that material. We saw a couple of phenomena that we've not seen before. The level of public interest in secondary legislation, and in particular in coronavirus statutory instruments, was immense. So enormous spikes in terms of use. And our user research showed us that people who were reading that legislation had a good grasp of the difference between guidance and law, and were wanting to read the text of the law as part of making their decisions whilst having regard to guidance. But they knew that that there was more to what they wanted to understand about what they needed to do than just reading the guidance. They wanted to read the text of the law. Now, it's been a good test for our systems, and I don't think, certainly in the time I've been involved with legislation publishing, if you go back 15 years, we were publishing online within 24 hours of producing the printed version of a statutory instrument. And you would allow 24 hours for registering a printed version of a statutory instrument, and the print would come along 3 days later. So that's like 5 days total elapsed time before you would see an online text being published 15 years ago, down to 19 minutes during the pandemic. So the systems have worked well. The public interest has been there, and it's been very interesting the way in which the material has been used by third parties to analyse the way in which the law has been changing. I think for me, the experience underscores the importance of both access to legislation, access to the law, and the importance of having institutions for whom that is their mission, and that are resourced to provide that access, including during periods of real emergency and considerable stress and pressure. And I'm now going to pass back to Nora.
Thank you so much, John, and perfectly timed. You know, you make the role of a chair for a panel so easy. Thank you so much for raising some hugely important points about the pressures, not just on governments, but on those individual people within governments who are tasked with the hugely challenging role of having to publish regulations and, I think, quite significantly rapidly made amendments and revisions to really significant pieces of emergency legislation that have been passed during this pandemic that have incredibly far-reaching impacts for people's human rights and freedoms, and legislation to which everyone's public safety, nay, their very lives were at stake in terms of following at very crucial times. So it is incredibly important that this issue is highlighted, and that it's great to see that the rule of law is being upheld at all times, because as we know, previously we've had discussions at the conference about how there has been some overreach by certain governments internationally in terms of with respect to the restrictions on the right to protest and the restrictions that have been placed on certain organizations sharing information online regarding different interpretations of legislation and what they'll mean in practice. So the importance of having a trustworthy institution that people know they can go to be able to check what the current status of a piece of legislation is, or a secondary piece of legislation, is just so crucial. And it was then, and it still continues to be. So thank you so much, John. We already have a question for you, but I'm going to hold back on that because I'm going to introduce our second speaker. So our second speaker this morning, I'm delighted to say, is Silke Carlo. Silke is the director of one of the UK's leading civil liberties organisations, Big Brother Watch. She is a lifelong campaigner for the protection of civil liberties, particularly in the context of new and emerging technologies. She works to uphold rights in the fields of state surveillance, policing technologies, big data, artificial intelligence, and free expression online. Before joining Big Brother Watch in January 2018, she was the Senior Advocacy Officer at Liberty, where she led a program on technology and human rights and launched a legal challenge to the Investigatory Powers Act. She's previously worked for Edward Snowden's Official Defence Fund and Whistleblowers at Risk. Silke is also an information security trainer and organises Crypto Party London. And she is the co-author, of Information Security for Journalists. Silke, you're very welcome whenever you're ready. Thank you.
Thank you so much, and thank you for inviting me to this, and to everyone else for your really interesting panels and questions and everything else that's been going on in this conference since yesterday. I want to run through some of the ways in which I think the pandemic has particularly affected privacy rights over the past almost 2 years now. I agree with something that Graham said earlier in that this is a period of exceptionalism, and it's perhaps the closest that we'll see to war-like law and policy making without us thankfully being in a war. It's been a huge stress test for human rights and the rule of law. I don't think that the UK has come out of that particularly well, for some of the reasons I might explain. But one of the things that's interesting, I think, for sort of human rights in our culture, exactly as John said, is that so many more people have taken an interest in their rights and an interest in the laws that apply to them. And that is why I think that despite all of the challenges, I hope that that's a moment that rights advocates can seize and not let people down. I think we mustn't let people down at this moment, that the importance of rights and the rule of law is so prescient. So now I'm going to just race through some of the most notable things that happened from a privacy rights perspective and the data protection perspective over the last 18 months, 2 years. The first one that I know we're all acutely aware of is the contact tracing app. Of course, in the context of a pandemic, contact tracing is one of the most important things that the government has a responsibility to do. This brought home, I think, the importance of privacy and trust. And trust has been absolutely the bedrock of success for pretty much any policy related to public health over the past 2 years. When the first contact tracing app was proposed as a centralized, heavily kind of intelligence agency managed project, there was a significant trust issue, and rightly so. It was out of step with the way that lots of other countries were doing contact tracing. And I think that was actually a very tiring process, but it was quite an extraordinary lesson for policymakers to learn about that importance of trust and privacy. And when we take privacy out of this kind of abstract, woolly notion and really put it into practice and see how important it is to people, and how important it was to that behavioural change. I have to say, though, the government even really could have done a lot better on contact tracing and privacy when the legal obligation was introduced for businesses to take an active role in contact tracing. So you'll remember the days when if you wanted to go to a pub or restaurant, you had to give your contact details, whether that was through the app or through writing them down on a piece of paper. The government did not view itself as a data controller in this aspect. It did not take very much responsibility for that data collection at all. And there were lots of businesses, especially small businesses, that were really ill-equipped to do this. And as a result, we've seen an awful lot of data leakage. And as a result, people are getting, I think, more kind of fraudulent calls and marketing calls and unsolicited contact than they have done for a very long time, since GDPR in particular. And unfortunately, also some instances of harassment. This particularly affected women and young women who found that they were being contacted by members of staff from businesses that they'd been to because they had taken their contact details. So there was a whole range of issues around contact tracing, which was really such a central pursuit during all of this. But the impact on privacy has been diverse. Another big issue, of course, has been the COVID-19 data store, which we still know very little about. Huge institutional change. This is a government and company-run data store managed by, that includes companies such as Faculty AI, Palantir, Google, Microsoft, Amazon, that's collecting masses of population level data and using it in ways that we don't fully understand. But the broad notion is that it produces dashboards for government to make policy making on. But there's clearly a lot else going on there. And it's also clear that this is now kind of embedded into the working of government. There was talk about also applying this to flu, about how this data store is going to be used in other contexts. If you look at work of the likes of Big Brother Watch, Foxglove, others, you'll see it's been incredibly hard to get the most basic details out. Data protection impact assessments, what types of data are being collected. We've seen at different times on policy documents, political opinions, all kinds of sensitive medical data, 111 calls, all kinds of data going to this giant data store. So, of course, there's been an opening for a big data grab during this process too. On a more specifically research level, we found that a SPY-B project had led to location data unwittingly being collected from millions of people as part of a research project into behavioural change around vaccination. So that meant that when we were all going off to vaccination centres, phones were being tracked, and then over a period of time to see how your behaviour changed. Now, you might say, well, that's a great use of data. It makes sense from a research perspective, but it comes back to trust, comes back to people's awareness. Did it need to be done in that way? Did people need to not know that they were then going to be tracked and that their data was going to be used in that way? I think there's some serious questions over that. We've also seen the use of more advanced data processing as well. Faculty AI is going to come up a lot here because they had, I think at the last count, 9 government contracts and a lot of good government contacts too, actually, friends in cabinet. There was a contract that Faculty AI had with the Ministry for Housing, Communities and Local Government that didn't make an awful lot of sense. They had license to do machine learning on masses of data, anything from social media data to utility bills, and there was no clear purpose. There was nothing in the contract or policy documents that set out exactly what this was about. Eventually, we got a revised contract which said that Faculty AI was trying to understand public perception around basically pandemic policy. That kind of sounds to us, you can read more about this on The Guardian. We did a piece with The Guardian on it, but it kind of sounds like one of these familiar things where there is a door open for lucrative contracts and big data gathering, and then you can kind of see what happens and work out the the purpose later. This is something actually the government is explicitly seeking to do in its reform of data protection laws that I'm sure some of us are going to be still struggling on the consultation response to tonight. But at the moment, under current data protection law, there's a big question mark over this kind of thing. Similarly, Faculty AI got a contract to do chest imaging. So when people were in a hospital, if they had any chest images taken, that was given to Faculty AI, and they could do machine learning on that data. But again, this was done without the knowledge or consent of individuals. Why? It doesn't seem clear why we wouldn't try during this process to show the benefits of the way that data can be used, and have a more consensual relationship around people's privacy, especially when it comes to medical privacy. And just to be clear, like anyone, of course, I support the use of data in the pandemic context, and there are very noble aims, but none of us should be naive and say there aren't also commercial aims and power aims and other kinds of motivations that are involved in a time like this. Then moving very briefly on, I've got to wrap up, but moving very briefly on to the surveillance space, we had drone surveillance of ramblers, use of the ANPR network, which, as you remember, was born in the wake of terrorism. Suddenly we see it being applied to check whether people are moving between counties, despite the fact that wasn't a breach of the law, but there was a lot of misunderstanding from police about what was a breach of the law. We've seen the growth of thermal surveillance, so infrared scanning cameras, face mask recognition, social distancing recognition, more surveillance of people when we're working from home. And now, I think the most egregious, of course, is vaccine IDs. And this is something that actually has the power to reorganize society. And it always seems that when we lose privacy rights, this is in a drastic way, such as this is the kinds of thing that is at stake, a fundamental rebalancing of equality, and a whole host of rights in our society, whether it's the right to work, freedom of movement, and of course medical privacy. That's something, as always, I'm much more keen to talk about, but I'll hand back to Nora and look forward to hearing from the other panelists.
Thanks so much, Silke. You have given us a really fantastically succinct but quite detailed overview of the huge impact that the COVID response has had for specifically the right to privacy, and then by extension as well, the right to data protection. And I think you gave some really very important examples of how this, huge stress test for human rights is very much ongoing. In the example of the vaccine IDs, that is something that the UK and other governments are still grappling with, and we could see potentially a further application of that across the UK come winter. So this is an incredibly important public interest issue, and it's very live. And I think your point as well also speaks very consistently with some of the other concerns and papers raised throughout the conference in terms of the need for safeguards and independent, robust oversight on what are effectively wartime emergency measures that have huge impacts on people's freedoms, human rights, of course, privacy in particular, but also then for the rule of law. The accountability and transparency issues are rife when not just legislation is being passed at such a pace, but when procurement and tenders are being allocated to some very significant companies and organizations without there being a clear record of how the particular terms and conditions and the particular impacts for the public are going to be addressed in those particular arrangements have been highlighted. And you've mentioned a number of very important legal challenges brought by various groups on that note. And the importance of the fact that independent oversight bodies and, of course, civil society have played a really important role in this, both in the UK and elsewhere, in highlighting the dangers of mission creep. And you mentioned the personal data, where you have huge troves of personal data, sometimes highly sensitive data, in a lot of cases highly sensitive because we're talking about people's health data. And there are huge issues there with the repurposing of this data and mission creep. People may have understood that there was a strictly necessary purpose for use for it, for countering the pandemic and for research purposes. But we do now see, as you rightly pointed out, that this overreach of there being a repurposing of using this very sensitive population-wide often data for very different purposes. And you rightly highlight the issues of people's consent and the transparency and accountability issues that follow. So thank you so much, Silke. And these are very important points that I hope we will go back to. But perhaps this is a great segue in terms of introducing our third speaker, Professor Fraser Sampson, who is in the capacity of providing independent oversight at the Home Office for some of these powers. So Fraser holds the joint roles of Commissioner for the Retention and Use of Biometric Material and Surveillance, and being the Surveillance Camera Commissioner. Professor Sampson has over 40 years' experience working in the criminal justice sector, having served as a police officer for 19 years before becoming a solicitor specialising in policing law, conduct and governance. He has also worked as the National Chair of the Association of Police and Crime Chief Executives, and was appointed CEO and solicitor to the Police and Crime Commissioner for West Yorkshire in 2012, later being seconded as CEO to the Police, Fire and Crime Commissioner in North Yorkshire. He is an honorary professor and member of the advisory board at the Centre for Excellence in Terrorism, Resilience, Intelligence and Organised Crime Research at Sheffield Hallam University, where he gained his PhD in digital accountability and law enforcement. Fraser, you're very welcome.
Nora, thank you very much. And thank you for the very kind invitation to reflect on data in a pandemic from the perspective of my two statutory roles, those of the Biometrics and Surveillance Camera Commissioner, each of them under the Protection of Freedoms Act 2012. And in so reflecting, I go back, as lawyers often do, to definitions. The etymological root of pandemic is, of course, pandemos, meaning crudely across all people. And one of the great things about this role, or these roles that I now have, is that after decades of trying to get people interested in matters of dull legal compliance, I'm now in an area about which everyone already has an opinion. So the subject of biometric surveillance is pandemos. One of the great fears that many people harbor about surveillance in this area is what one American legal researcher once called omnivalence. So in other words, the state's ability to watch us all. So literally pandemic surveillance. And in one of the COVID litigation challenges to the government in 2020, the High Court described what were truly exceptional circumstances, the like of which has not been experienced in the United Kingdom for more than half a century. We are faced with a virus that is a genuine and present danger to the health and well-being of the general population, which was in Hussein, that the High Court was even considering a government order prohibiting public worship in the United Kingdom in the 21st century is telling enough. So the risk was globally pandemos. So the coalescence of these pandemic features, the capability for almost total public surveillance, the threat to the entire population, and the opinions of every citizen around it, make this an extraordinary time and an extraordinary subject. Technological developments in biometrics and surveillance, as we know, have meant that our capability and capacity to prepare for, respond to, and recover from global crises has increased beyond anything our forebears might have realistically imagined. And at the same time, is also created dependencies and vulnerabilities on a similar scale. There are some very specific policing issues that arose in the exigencies of the COVID-19 pandemic. Aside from the broader issues of relationships between communities and their police, where there was a clear blurring of law enforcement and health enforcement, there were some other interesting evolutions. For example, one is the use of voluntary attendance as opposed to arrest. And every police force across England and Wales increased its use dramatically for obvious reasons in terms of avoiding bringing people into contact in custody suites and particularly in contact with officers and detention staff. VA versus arrest is a very good thing for constitutional lawyers, given the intrusiveness of arrest, particularly in this country where you can go through the whole process and never meet an independent judge. But a very bad thing in terms of biometric capability in a country where the power to take biometrics is directly linked to arrest. Many suspects in criminal investigations have passed through the hands of the police over the past 18 months without their biometrics being taken. How many and to what effect is not yet reliably known. We also had the temporary legislation, which was introduced, as we've heard from previous speakers. The exigencies of the COVID pandemic required emergency temporary measures of some extraordinary speed and scale. And it's critical to ensure that they were exactly that, temporary and only used to the extent necessary to counter the threat. And one of the first tasks that I was faced with when I was appointed to this role in March was reviewing the national security determinations, which are, of course, determinations made by chief officers of police to retain the biometric material of people who, although they haven't been convicted of any offence, nevertheless are assessed to represent such a threat to national security that their biometrics must be retained. I have done since March over 600 NSD reviews. And for the period of the pandemic, the need to make those determinations on chief officers was suspended temporarily in 2 6-month blocks under the Coronavirus Act. My first public role in this function was to write to Parliament and make an assessment of the extent to which the suspension of those requirements for what is an enormously and enduringly intrusive police activity had been complied with in the way that Parliament intended in passing that legislation. The reports, I'm very happy to say, gave me absolutely no cause for concern and no reason to believe that the police were regarding that particular power or suspension of a need to apply in anything other than the way it had been intended, and were very clearly gearing up to return to business as usual. And that's the content of my report to the Home Secretary and Parliament. But I think the risk of permanent and irreversible incursion by the state during times of emergency is well documented. I think one of our many challenges now will be to ensure that the balance between responsible intrusion, accountable regulation, and societal expectation is resumed pandemos. I'll go back to you.
Thank you so much, Fraser. I think your point is a very excellent one. Are we now in a permanent state of pandemos? This was raised earlier on in the conference. Have we gone from an emergency state for more than 20 months to this now transitioning into the new normal for society? And if such a transition is what in fact is taking place, is this a lawful one or a proportionate one? And are these measures being adequately assessed for their lawfulness and proportionality? I think the role that you play is quite significant now more than ever when you consider the convergence of biometrics and CCTV systems within the context of the pandemics. There were many countries around the world that used facial recognition to identify individuals in terms of contact tracing purposes now. Whether the proportionality of those particular incidents comply is a very interesting question, because of course we know that not every country using such powers operates within a democracy. We all very much talk about these terms and rights and obligations within a democratic state, but of course there are countries that do not operate in that way, and but then provide systems to democratic societies that are meant to comply with those obligations and rights. So I think your point about us being on the verge of a capability of total surveillance is a hugely relevant one. And it is with great pleasure that we will now be hearing about, I would imagine, a very similar perspective and a set of, very complementary expertise and views from the EU perspective. And that will be coming from our fourth speaker, who joins us from Brussels, Anna Bukta. Anna is head of the Policy and Consultation Unit at the European Data Protection Supervisor's Office, EDPS. She leads the work on legislative advice to the European Commission, Parliament and Council. She has extensive experience in data protection and privacy regulations, institutional law and litigation before the Court of Justice of the European Union. She is one of the institutional rapporteurs on EU data protection for the FIDE 2020 conference. And previously, Anna worked at the European Commission. And before that, she was a researcher at the Interdisciplinary Centre for Law and ICT at KU Leuven. Anna has a master's degree in law from the University of Warsaw and an LLM degree from KU Leuven also. Anna, you are very welcome. It is lovely to see you whenever you're ready.
Thank you very much, Nora, for the invitation, and good morning or just good afternoon, everyone. I'm really delighted to contribute to today's discussion. Indeed, I was listening, especially to the two previous speakers. I was wondering how to restructure my planned intervention on the fly, not to be too repetitive. I'm really happy to already have heard so much about the increased digital surveillance. We even talked just offline before this conference about this period being a stress test also for data protection and privacy legislation. So I was very happy to hear Silke already making an introduction to this concept. So I will try to very much just build on what was said previously, because indeed, from the perspective of a data protection supervisor authority or regulator, such as the EDPS, and we obviously work very closely with our counterparts and all of the EU and EEA member states, and also still with the ICO. I'm happy to say, although the institutional collaboration is much more difficult in the past few years. So I will try to make this intervention from the EU perspective first and foremost, but I do believe that it is to a large extent universal, and I hope that will be relevant for this audience as well. So yeah, I will not repeat how the digital technologies from the very beginning of the pandemic were hailed as almost the silver bullet and the solution that was supposed to free us all and allow us to surmount the extraordinary challenges to public health. Probably, as always, there was a fair deal of business trying to promote the latest buzzword in that, but I think it was fair to say that maybe we as a society are the time is ripe to try and use the technologies that we have at our disposal to support public health authorities in particular. So as such, from the EDPS perspective and from the DPAs, we were careful not to use data protection or fundamental rights or privacy as an argument against the use of technology as such. We tried to be open-minded and open to arguments and demonstrations how specific technologies could be useful as well as proportionate and necessary under the circumstances. And of course, as it was already mentioned, we were mindful of the fact that this is quite an extraordinary circumstance. So it might well be necessary to reconsider certain traditional approaches and demonstrate a level of flexibility in interpreting current rules, on the understanding, however, that we are indeed speaking about an emergency and particular circumstances, which should be limited in time. And I will come back to that point in a minute. So for us, data and technology should be used, but as tools to empower rather than control, stigmatize, or repress individuals. And also, we were arguing from the very beginning that data and technology may be part of the solution, but they will never be the single bullet that will magically, allow us to go back to business as usual. And we still insist on the way, on the need to define and find a way back to normality. Now, from the EU perspective, it has to be stated that the EU competence and matters related to health and public health are relatively limited. So this has been quite visible. We didn't see much harmonization, and this is because of these institutional considerations. We saw some coordination at most, and a lot what I would describe as soft law emerged at EU level. So recommendations from the European Commission, guidance, guidelines, and other commentary from national as well as European data protection authorities sitting together as the European Data Protection Board. And here I have to say, it was, I consider this a positive development, how much emphasis and how much attention there was from the European Commission, also from national authorities across the board, to ask for advice and to try and make sure, to the extent possible, that the legal frameworks that were being put in place would be as compliant as possible with the normal regulatory framework for data protection that we have in place. So for the DPAs, that was a very intense period as well, because as mentioned by some previous speakers before, all of a sudden we were under pressure to deliver very, very quickly. We were solicited to deliver a very, very, very technical advice on technical complex issues in a very particular area of expertise, health and public health and epidemiology. That was by way of scale and intensity and time pressure quite unprecedented. At the same time, we saw a lot of privacy engineering happening in real time. As EDPS, we have tried to promote this idea of privacy engineering, and we have worked for many years to bring IT researchers interested in privacy and data protection compliance, for example, in the context of the IPEN network. And all of a sudden, these meetings turned into almost real-life hackathons to try and deliver solutions for contact tracing applications that would be interoperable and privacy compliant and decentralized. And here, I have to say that with hindsight, of course, different solutions were sometimes chosen at national level. And not everyone opted for the more privacy-preserving, decentralized architecture for the contact tracing apps in particular. But we also saw, probably by necessity, emergence of interoperability frameworks and platforms at EU level. And in fact, these interoperability rules nudged member states, at least most of them, to move to a more decentralized architecture. So, for example, in France, we saw first a very much centralized architecture for this national application, and this had to be reversed at some point, precisely to ensure interoperability of their national app with other solutions, with the solutions that were adopted across Europe. Otherwise, what we now have. Also, in terms of QR codes, that is slightly different. different framework, of course, but it was a similar consideration. The app would only be possible to use within one member state, and that was considered a suboptimal solution. So I would certainly think that quite a lot emerged in terms of advice, structures, frameworks, legislation at EU level. That was obviously less because of these considerations of limitations of what can be harmonized. And then, of course, the challenge would be how to apply that in the future, or in practice rather. Just maybe 2 or 3 final remarks. I think at this stage, we are probably no longer in the initial phase of the emergency response. So despite the fact that we have another waves in some parts of Europe in particular hitting us, it seems to me that time has probably come to consider already what the new normal should look like. And here, I believe that in particular, we need to consider that the measures that were considered proportionate and necessary yesterday are maybe not necessary today, and will certainly not be proportionate tomorrow or the day after tomorrow. And so, in other words, I think it really is time for policymakers and organizations to take the necessary measures to try and put the genie back in the bottle, and at least try to limit some of the extraordinary measures in time. Again, being realistic, it will probably not be possible within the next days, weeks, months. But I guess we all need specific timelines to indicate by when this extraordinary state of emergency may end, and what would be the acceptable level of intrusion into the private sphere, especially digital intrusion, for the time after the pandemic. Thank you very much.
Thank you very much, Anna. And your intervention, I think, speaks very well and very consistently with the previous points raised by our other speakers, particularly Silke and Fraser, and also points raised by John as well regarding the importance of legal certainty in particular as we transition from the initial stages of the emergency times to now what is the new normal. But then also remembering that as we emerge from what is an ongoing, it seems, stress test for data protection and privacy and other fundamental rights, that we also take stock of the fundamental principles that underpin those pieces of legislation. And just to give one example, vaccine passports, for instance, in terms of the purposes for which they should be used for, there is precedent in terms of yellow fever certificates being used solely for international travel. But then again, we have to put this in context. We're not talking about the paper-based systems of decades ago. We are talking about huge troves of personal and highly sensitive health data that can be easily shared and easily processed and easily analyzed by a huge number of organizations that on a level and on a scale that could never have been anticipated several decades ago when we had policy discussions about yellow fever. So, we're in a very different space now in terms of the digital era and the capacity of AI and other types of data analytics, which we do have to bear in mind when we consider these proposals. And particularly when it comes to what is actually a pressing social need in our society. That's the threshold we're talking about huge infringements to people's data protection and privacy. These are emergency powers, they're far reaching. So it's not about if they're desirable or even necessary. It's a much higher threshold. It's the question of, are they strictly necessary? Has there been independent evidence to show their effectiveness, whatever the data-driven measure is, whether it's contact tracing, as you rightly pointed out, Anna, or whether it's the next measure to be introduced, such as remote biometric surveillance? On what possible basis should that be permitted, if at all? And what is the independent evidence substantiating the effectiveness of such privacy interfering measures? And I think one particular data protection principle that's hugely important right now, that speaks to one of Silky's points, is huge collections of personal data by governments and other organizations, and the application then of the storage limitation principle, and that when there is an assessment of when that should be deemed as, well, when is it necessary? When is it now adequate to delete some of that data? And deleting that data means irreversible destruction, not just data that can be pseudonymized and then brought back to life, reanimated or re-identified again. So hugely important data protection questions for us all going forward. And thank you so much, Anna, for that contribution. And last but not at all least, we have to ask ourselves, in terms of everyone's rights and responsibilities, what role can academia play? What is the role of the humanities and the social sciences in these very important policy and governance debates and questions? And last but not least, our final panelist will be addressing some of these issues. Hitan Shan, he is Chief Executive of the British Academy, the UK's National Academy for the Humanities and Social Sciences. Hitan is Vice Chair of the Ada Lovelace Institute, which focuses upon how to ensure artificial intelligence and data are used for public good. He's on the board of the Legal Education Foundation, a philanthropic body supporting a better justice system. He is a trustee at St. George's House, a charity based in Windsor Castle, which organises discussions on issues of public interest. And Hitan is on the advisory board of the Science Media Centre and the Bennett Institute for Public Policy at the University of Cambridge. Hitan, you're very welcome. And I'd just like to stress that we will actually conclude today at 12:45, so you don't have to rush your contribution. And to all those in the audience who've been asking about Q&A and questions, we will have a little bit of extra time for that. So Hitan, whenever you're ready, thank you.
Thanks very much, Nora. And I wanted to give a slightly complementary perspective to the one that we've been hearing about. And of course, all of the issues that have been raised around the surveillance society, digital tech kind of issues around privacy and so on have been a really important feature of the pandemic. But I wanted to tell a different story so that it's not overlooked. So let me start with statistics. And the efforts of those producing statistics, health and social care statistics in particular during the pandemic, have just been remarkable. So think about the ONS COVID infection survey, which was stood up basically in 2 weeks. The PHE UK coronavirus dashboard, which I think at one point had over 70 million views in 24 hours during that third lockdown, and also their kind of analyses of vaccine effectiveness. Let's think about the fact that we managed to conduct a successful survey in England and Wales during a pandemic, which I think has been an extraordinary achievement of the statistical profession. And I think, there have been challenges, of course, of publishing data at speed, and sometimes that hasn't always worked in the right way in terms of kind of balancing quality and transparency. So think of, for example, the famous Chris Whitty next slide please presentation about a year ago, almost to the day now, where actually, those of us that were watching it, I think it was just before Strictly Come Dancing, wasn't it? Were trying to say, where's this data come from? And I know that it had been pulled together at speed, but there were no references, there was no published data alongside it, and so on. So that was where the statistical system intervened, and there was a letter sent from the UK Statistics Authority to Chris Whitty saying, in future, we'd really like you to make sure that you signpost where that data came from. But those things happened, but there weren't that many instances, I think, of that. That wasn't really the major story. A different statistical story which came out was the exposure of a number of data gaps, for example, around social care, around mental health, around ethnicity. And again, I think the statistical system tried to do what it could to patch up some of those things, but it did expose where we had not been collecting data effectively enough in the past. So that's, I think, been one of the stories which perhaps complements that, the slightly more negative story we're hearing about surveillance data and so on. But the data has been, statistical data has been extraordinarily important in helping us get through and just understand what's going on in society. And of course, I think the statistical profession is much more grounded in the way of thinking around data protection and so on, those privacy safeguards tend to be built into the way that they work, and they're tending to work with aggregate data sets. So it's a very different aspect to the whole story. As an aside, it's worth questioning, where was AI and big data in all of this? I mean, the last 5 years we've been hearing about the hype of all of that. Actually, what did we do? We went back to standard survey data to find out how levels of infection and so on. So I think, again, it's been a useful kind of puncturing of that kind of hype story, and almost a rebalancing to say, statisticians were actually the core profession here. It wasn't data scientists and big data analysts and AI professionals. Another interesting aspect of all of this was the way that government and academia, I think, worked together. And it just seemed that there was a much greater porousness between government and academia during this period. Government has sometimes, I think, closed the doors and said, we're doing policy over here, we'll let you in occasionally to talk to us. But, in this kind of emergency mode, I think the shutters came up partly because government said, we don't know what's going on, we don't know what we need to know. And so the research community was brought in much more effectively. There was more open sharing of data for research purposes. And I think that was really powerful. And one of the questions for me is, what aspects of those can we build upon and maintain those relationships as we go forward? I suppose, as an aside, it's worth noting that we were slower to consider social data alongside health data. Now, at some level, that's obvious. It was a health crisis, and so we turned to the health data first. But of course, what we've realised is that so many of the health effects were actually tied in with social effects. It depended upon whether you were able to work from home as to whether you could avoid putting yourself in certain kinds of situations, etc. So, I think the bringing together of the health and social perspectives was really important, but one lagged the other, which had a whole series of negative effects. Another thing I'd point to is just the way that data and statistical data in the public domain has led to, I think, broadly speaking, a relatively intelligent conversation. Now, that's not to, one can point to lots of unintelligent conversation, but that has always been the case. But the bar has really been raised, not least through Twitter. I mean, some extraordinary people on Twitter, analyzing in real time what is coming out of the data. And if you followed, the sensible people, as it were, you would get very, very interesting data, which was challenging back to government at times on what the data meant. And that, I think, was extraordinary. And we saw people like John Byrne-Murdoch's work at the FT, which was giving really clear data viz information to the public on a kind of real-time basis. Max Roser's Our World in Data, which was doing the same at a comparative global level. I'd also point to the work of, I'm going to touch on a few things that I've seen because of the kind of various hats that I wear. So, I have an interest in all of the things I'm now going to talk about, but the Science Media Centre, where I'm on the advisory board, play a really important role bringing the scientific community together with journalists. And that nipped in the bud a lot of bad stories and made sure that that the quality of reporting on the data was much, much better than it could have been. So institutions like that working in the background really matter. Let me pick up a little bit on the conversation that's been had around surveillance data and so on, and a couple of initiatives that the Ada Lovelace Institute has been running. One is a Citizens Biometrics Council, which reported earlier this year, and what was really interesting from that is asking informed citizens who'd really thought about the issues, what would you like to see? And it was clear they wanted comprehensive legislation and regulation, they wanted independent oversight, and they wanted minimum standards. And that seemed to me to be a really good model for how to think about these new areas that are opening up, where we don't yet have the obvious answers and we don't know where the public is at, as it were. And more widely, I think all of the kind of ADA work has shown, much as we've been talking about today, the public want clarity of the boundaries of data use, rights and responsibilities. And even in an emergency, it can't be a free-for-all. We should also touch, I think, on the other aspect of all of this, which is the digital divide, and remembering, again, as Ada research has shown, there are a whole load of people who can't access broadband or don't have smartphones. And this leads to a series of things. I mean, Silky was talking about the sort of the divides that we see in terms of that could be created. So some people wouldn't be able to benefit from the tools that might be coming out, for example, contact tracing, but also we might end up with missing data. So I think all of those things need to be thought about. I want to end with, because this is a conference primarily for the kind of legal end of the world, with something about the data in the justice system. And again, this is a story about missing data and the impact that has had the absence of data undermining efficiency and democratic accountability. So, the government, I think we have found, just has not been holding basic data. And this I'm basing on the work of the Justice Lab at the Legal Education Foundation, where I'm on the board. So we don't know the number of judges that sat during COVID, the number of remote hearings that were had, or what the impact of the pandemic was for people pursuing their cases through the system. And the Centre for Public Data has shown that 40% of the written parliamentary questions that were asked to the MOJ during 2019-20 couldn't be answered due to the lack of data. So this is just, as we're thinking about case backlogs and so on, we don't know how to tackle them. We don't have the numbers, as it were. So I think there's a real problem there. There are some opportunities. So there's a program of court digitization, which is about to happen. And we made some recommendations in our digital justice report in 2019 about how that can happen in a really good way. That the work that John was talking about in terms of the National Archives, you're also going to be publishing judgments, and that's really important in terms of court judgments, because most of that is now hiding behind private paywalls as against being open to the public. But again, we'd want to make sure that that's not just restricted to the senior courts. Otherwise, that could be seen as a failure. We've really got to open this data up. And finally, we've got to think about governance, and the MOJ really needs to formalize its senior data governance panel, which is kind of operating as a sort of shadow body at the moment, and do public deliberation of the sort that I was talking about that the Ada Lovelace Institute has done with biometrics, and also another initiative I was involved with where the test and trace program did that with a group of the public around COVID data, and a report's going to be published on that later this year. So that, I think, has been a really good way of looking at where the public is at. So to sum up, I wanted to give a slightly different story about data in the pandemic to complement the one that others on the panel have given. And statistical data has been an incredibly powerful force for good, and we mustn't overlook that. But we have been missing data across the piece, including in the justice system, which I think is really needs addressing. And we always need good governance, including public voice. And I think finally, I'll end on a theme that others have picked on, which is the role of independent organisations throughout all of this. So the Office for National Statistics, is independent of government, of publishing good data and trustworthy data. Bodies like the Science Media Centre, Ada Lovelace Institute, Legal Education Foundation, and others are able to bring to bear independent voices in areas where otherwise, who are the people that will safeguard the public interest? Thank you.
Thank you very much, Hatan. Yes, it is definitely good to have a focus on the positive contributions that data collection has added to the pandemic response, how it has helped to inform policy making in particular instances. And I note the very relevant example that you give about the reliance on health data and the way in which boundaries then opened, or certainly more porous, between governments and universities, and particularly in the UK and the University of Oxford. When you think of the AstraZeneca vaccine, I have a wonderful, I think, post-lockdown memory of Wimbledon, of everybody standing up to cheer the scientists who led that particular team. And when you think of a few years ago, where you had very senior figures in government questioning, well, who needs expertise? We're tired of experts, and we're tired of anything that could be contributed there. It's very welcome to see a very significant step change, certainly in public perception and awareness. And it has also informed the conversations that people have had. So that increased focus on the importance of science and research is very welcome. And it's an important area to emphasize without question. And indeed, independent institutions, the important role that they're playing in independent oversight and accountability of different organizations is hugely important in all of these discussions. The Ada Lovelace Institute has done some excellent work in this area. And with regard to biometrics, as you mentioned, I think we're all looking forward to the 2022 Rider report on biometrics coming up next year. That's going to be based upon a lot of the fantastic public attitudinal work, which again is very important to have that participatory democracy, which I think touches upon the consent issues that Silke also raised earlier on, which is very significant. Not to rain on your parade, but I will I would note, I think, some caution in that I think while certainly this government, I won't speak to all governments, while there was certainly an emphasis on following the science, perhaps some months ago, it does indeed seem that following the science is less of an influential factor at the moment in terms of government approaches. But of course, that is definitely that's definitely an interpretation to be shared and debated among many. And I think we have had a focus earlier on in the conference from Caroline Waters from the Equality Human Rights Commission. She talked an awful lot too about data gaps and how we actually have, still quite a significant digital divide, and actually how a lot of the rapidly adopted measures during the pandemic has exacerbated a lot of those digital divides, and that the need for sustainable, reliable statistical collection of data that you mentioned, that's more important now than ever if those digital divides are going to be addressed. So that is hugely important. Huge thanks to all of our speakers, discussants, and chairs. I'd like to give a very special thanks also to Professor Diane Coyle, who delivered this year's annual lecture for 2021. And thanks so much to this wonderful panel for a really rich and fascinating collection of insights and reflections that speak to a lot of the themes and issues that were raised over the past 2 days. And this then leaves me with nothing else to say, but to again thank this panel for an incredibly rich and insightful and fascinating conclusion to this 2-day conference. And that I wish you a wonderful weekend, and that I hope to see you all again soon. Thank you.